What rhythm are we looking at here?
I think it's A flutter because the F waves look like sawtooth pattern.
Yes, these little ones, right?
Yeah.
They look like sawtooths. Perfect. Sometimes there are rhythms you can just take a quick glance at and say, yep, that's A fib or A flutter, for example. Of course, to diagnose a patient, we do a more thorough assessment, but as the nurse, to recognize that something is wrong is super important. This is atrial fibrillation, a quivering or vibrating like appearance from the P waves. A very fast heart rate, supraventricular tachycardia, supra meaning above, so this originates in the atria. If the patient is stable, we can try vagal maneuvers first. If unstable, we go straight to adenosine that will hopefully convert SVT into sinus rhythm. Now this is ventricular tachycardia. It originates in the ventricles. We call these mountain peaks or tombstones. They are no bueno and can lead to ventricular fibrillation or cardiac death. Ventricular fibrillation is the quivering of ventricles, so the QRS is unidentifiable. Immediate treatment is needed. Super important to recognize this. Classic ST elevation, we're thinking STEMI. Of course, we need to further test, but this is also no bueno. Interventions need to happen. Don't mistake V-fib for torsades. They look similar, but torsades looks like twisting if you're like wringing out a towel. Again, if untreated, this is another one that can be deadly. And that's about 7 cardiac rhythms that have hallmark signs just by doing a very quick glance. And sometimes that quick glance and identification is what can save a patient's life. So know your hallmark.